My topic is top 10 leading causes of death. It will be number 3 and 4 of the US list and also of ages 15 to 24 list. In the US, for number 3 is COPD, which is chronic obstructive pulmonary disease. The main cause of this is smoking, and its deaths per 100,000 people is 47.2. The main two prominent diseases is bronchitis and emphysema. And also, women, it's proven that since we have smaller lungs and we have the hormone estrogen, it's more of a worsening of this lung disease. And it used to be thought of a man's disease, but mainly it's just women that are just misdiagnosed. Bronchitis is the lining of the lung airway that becomes swollen, and over time the airways will narrow and be partly clogged with mucus that cannot be cleared. It is 70% of Americans affected are 45 ages and up. For risk factors, it shows that it increases with age, so people 65 years old and up have a rate of 64.2 per 1,000 people. Among 18 to 44-year-olds, the rate is 28.6 per 1,000 people. And women have double the rate of men. And in 2011, 6.8 million women have chronic bronchitis, while 3.3 million have it in men. Emphysema is air sacs and lungs are damaged and make it hard for the body to get oxygen it needs. So 90% of Americans are affected for 45-year-olds and up. Over the years, the incidence of emphysema has risen while it declined in men. So by 2011, 2.5 million women and 2.1 million men had emphysema. And this just shows the demographic of how COPD is the highest in Southeast and Midwest states. Number 4 is unintentional accidents, which include drowning, falling, motor vehicle traffic deaths, and poisoning deaths. So demographics, men account for more unintentional injury deaths than females. Drowning is the most common unintentional injury for ages 1 through 4. Motor vehicle is for ages 5 to 24. Poisoning, like drugs and other substances, are ages 25 to 64. And falling is more of a prevalent injury for ages 65 and up. And this is just to show the little demographics of the deaths, the unintentional deaths and injuries. For number 3 in the list of people in the age of 15 to 24 is suicide. Suicide is the act of deliberately killing oneself. The risk factors for suicide include mental disorders and physical. Mental includes depression, personality disorder, alcohol independence, or schizophrenia. Physical illnesses require or include neurological disorders, cancer, and HIV infection. But there are effective strategies and interventions for the prevention of this death. Demographics. An estimated 9.3 million adults have reported having suicidal thoughts in the past year, and estimated 1.3 ages 18 and older have attempted suicide in the past year. Among these adults who attempted, 1.1 million are reported for making suicide plans, but not actually carrying out with them. And the percentage of adults having serious thoughts about suicide was highest among 18 to 24 age. And this is just a chart to show the many different causes of suicide. And it could be from intimate partner problems, physical health problems, job problems, financial problems, and disclosed intent to take their life. And number 4 for the people in the age of 15 to 24 is malignant neoplasms. And it's basically cancer. Cancer is a disease in which abnormal cells divide uncontrollably and destroy body tissues. And includes lung, breast and prostate, and colon cancer. Lung, both men, is 31.3%, and women is 25.6% for lung cancer. Breast and prostate cancer, breast cancer is 15.3%. And for men is prostate cancer, which is 10.1%. And colon cancer, 9.4% in men and 10.1% in women. And this is a chart to show by age and by number of deaths.